Now is Dr. Robert Murphy. He's a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning, doctor.
Hey, good morning.
How would you assess this country's preparedness for vaccines and monitoring, et cetera, for monkeypox?
I give it a C minus. At least there was some vaccine available, but it's not enough. It's still not enough. The estimates are we need the country, these 3.2 million doses, that would be for 1.6 million people at high risk, and we're nowhere near that.
How can we still be fumbling this when we just went through the COVID pandemic?
Because we haven't learned our lesson yet. And that is really the thing. There needs to be, with all these pandemics that are popping up and epidemics, there's got to be a central force, office, some bureau that can cut through all the red tape and get to the work that's needed to be done. And, it took until yesterday for this to be declared an emergency. And, right now, it may almost be too late, and that the monkeypox could be endemic in the United States like it is in Africa.
Well, we're hearing Brazil, Spain, India all now recording their first deaths from this. Is this something that you could see happening here?
Oh, of course. Yeah, these, well, I've only heard the specifics about one case, one of the cases in Spain. The person had an underlying cancer and was being treated. And so what I suspect is that these 4 people have underlying immunocompromised conditions that are putting them at risk. So, I haven't heard about the other 3, but, those people exist here as well, and our numbers are going way up.
So I think most viewers maybe don't particularly feel threatened by monkeypox at this point, but is this something that can evolve and change and become more contagious or more serious the more it's out there with us not handling it appropriately?
Well, yes, absolutely. If you don't control these things when they're small, they're just going to grow, blossom, and change. And that's what we don't want. We don't want this thing to become endemic in the United States. It is in Africa, and they can't get rid of it. But now with all this focus on the vaccines, maybe they'll get rid of it in Africa as well. But we have to get rid of this thing, and it has to start now.
Dr. Murphy, I want to switch gears and talk about COVID-19 with Paxlovid. What is going on with Paxlovid? We keep hearing more and more cases of rebound infections, like with President Biden. Is it not working as well as we thought it was supposed to work?
Good question. I had rebound also, same thing. And, rebound happens. It's about 1% to 2% maybe. But there was a very interesting paper that came out this week that showed that even people who didn't take Paxlovid kind of have this stop and go type disease. In other words, a COVID. In other words, they get COVID, they get a little better, then they sort of get sick again. So that's actually turns out to be part of the natural disease. So actually relapsing from COVID may not be that unusual. And the thing is, Paxlovid works. It keeps 90% of the people who take it out of the hospital.